Civic Center TV salutes West Bloomfield area businesses with The Biz, where local entrepreneurs share their unique insight and knowledge on a wide variety of subjects. The Biz is produced with the support of the Greater West Bloomfield Chamber of Commerce. It's time now for The Biz.
Hi, George Moore for Civic Center TV. On this episode of The Biz, we are here at Lederman Kwartowitz, a Center for Orthopedics and Sports Medicine. We're here specifically to find out more about sports medicine and particularly how do joint injuries, which they specialize in here, affect you. So this will be a very interesting and painless episode of The Biz. Join us.
Sports medicine is an injury to a joint that came from moving the wrong way or sustaining an injury or a trauma.
Treating the joints, whether it's a shoulder, hip, knees, ankles, where people can have fractures, so traumatic injuries, or sometimes dislocations where the ligaments are torn.
It also refers to even everyday people who don't consider themselves necessarily athletes, who have what we call sports-related injuries.
And injuries to our joints can occur in a variety of ways.
Most people that have injuries tend to have them with an insidious onset, and what that means is that most of these patients either have very few symptoms beforehand, or this is something that starts as what they think is everyday aches and pains, and they progress to the point at which they come see a doctor because they're having pain virtually every day. Sometimes we get patients who maybe had fallen down the stairs, who were in a car accident, who stepped in a hole, slipped on the ice. Everyday things that you would consider just being an accident, for example, slipping on the ice, could cause what we would consider a sports-related injury, often because the mechanism is similar to somebody who is playing in athletics, or I suppose just everyday things can sometimes mimic what we would see on a playing field.
With our joints at risk, we asked how you can prevent these sports injuries.
I would say maintaining a stretching program, trying to be active throughout the week, and not just jumping into something that they're not used to doing on a regular basis.
Basic things involve stretching, so that's an important one. Most people have strains of their muscles because they stretch inappropriately, and we recommend stretching before and after working out or performing exercises to help maintain the appropriate muscle length.
We all love to operate, but here at Lederman Kwartowitz Orthopedics, believe it or not, our goal is to keep our patients out of the operating room. And we welcome patients coming in for an educational program on, this is hurting a little bit, what can I do to avoid injury? And we would evaluate the patient and probably get them into some kind of physical therapy to rebalance everything, to make sure there isn't compensation to overload one joint over the other. And that's probably the best way to avoid injury. But for the masses out there, you want to listen to your body, you want to try and warm up properly, you want to stay hydrated with water, not the energy drinks and not soda, and you want to try and know as best you can your own body's limitations.
One of the biggest headaches of a joint injury is to be put in a cast. Dr. Kwartowitz tells us why casting can be more harmful.
These kids that come in and are immobilized in a cast for 6-8 weeks and they haven't been using that arm, when you take off that cast, you see that muscle atrophy compared to the other side. So we're a big proponent of physical therapy, big proponent of working on the muscles, and I see it all the time where these kids will be diagnosed with an ankle sprain, but they won't get into a physical therapy regimen, and then they're back in the office again and again because they don't have the strength around that ankle, so they're more predisposed to having a recurrent injury.
Whether it's an aggravated pain or a rolled ankle, we all ask the question of when should I visit the doctor?
When is a sprain just a mild sprain, or when is it more serious? Sometimes you don't know. Obviously, if the swelling and the pain goes away after a few days, you're probably fine. If you're able to walk on it without any pain, you're fine. But if you have this ongoing nagging problem, or you think you're better and then you re-injure it, I would strongly suggest you go to a skilled sports medicine physician, because a mild or moderate ankle sprain will heal. And it'll heal faster if you protect the joint and you do some therapy, maybe some laser, it will heal faster. If you have some torn ligaments, the problem is you can be putting yourself at risk by trying to get back to sport or just getting back to normal walking. And if the joint's not stable, it will re-injure itself and possibly cause some cartilage damage. So I always say err on the side of caution. You go to a sports medicine doctor and you get examined. Because if the examination shows that you don't have normal stability, you need to be protected, or you might need surgery to repair a ligament or tendon. And that goes for the ankle, the knee, the shoulder, and even the fingers.
Sports medicine, we found a lot more things out about it, how you can prevent sports injuries while on your own, whether you're working out or you're into athletics, as we spend time here at Lederman Kwartowitz Orthopedics and Sports Medicine. And hopefully you've learned some things that will also help you in the future to maintain better health. We were here to show it to you. For Civic Center TV, I'm George Moore, and that's your biz.